The individual opinions of previous TIF procedure patients presented in this video do not reflect the opinions of Endogastric Solutions, Inc. and should not be considered as medical advice. Always ask your doctor about all treatment options, as well as their risks and benefits. Only your doctor can determine whether the TIF procedure is appropriate for your situation. While clinical studies support the effectiveness of TIF, transoral incisionless fundoplication, in treating chronic GERD, gastroesophageal reflux disease, individual results may vary. There are no guarantees of successful outcome. The TIF procedure may not be appropriate for every individual, and it may not be applicable to your condition.
I'm Brent Ridgway. I'm a construction estimator, and construction estimating and bidding work is stressful enough without GERD and the acid reflux that it causes. I had regurgitation at night, I had heartburn, I had a burning of the throat and the chest, I would burp a lot. I have taken so many medications for acid reflux. I've tried several and they've done nothing for me. So when the medication doesn't work, it's time to look at something else. My ENT doctor referred me to Dr. Schwartz. I was told about different procedures that were available. And some of them I had never heard of before. I never heard of TIF, the incisionless procedure. When Dr. Schwartz did explain and outline everything that was going to be happening on the surgery, I thought, how easy can that be? And I'm here to tell you, it was very easy. I had a recovery period of approximately a day. I came back to work the following day, on Monday, and everything was back to normal. I was on a liquid diet for approximately 1 week. I enjoyed it. And a good byproduct was I lost a few pounds doing that, but eventually I came to realize that once I could start eating and drinking the things I couldn't eat or drink before, it didn't affect me. It's just made such a change in my life. My wife notices it. We go out to eat, and I'm not a large eater, but I like to eat. I like to eat Italian food, Mexican food, and those are things I had to avoid for the past 7 or 8 years. My wife also has mentioned that you don't clear your throat all the time anymore. You're not coughing all the time anymore. And believe me, that interrupts your speech when you're on the phone with a client. Since I had the TIF procedure, I have such a better lifestyle. I can function, I'm sure, at a higher performance level than I did before. And I would certainly recommend the TIF procedure to anybody who had GERD or acid reflux. I had the procedure done and it has made such a drastic change in my life, all for the better.
All surgical procedures have risks. Therefore, it is important to understand the associated risks. Before you decide on a procedure, speak to your physician in detail about the risks and complications that may occur. Expected risks or discomforts as a result of an endoscopic procedure include sore throat, left shoulder pain, temporary abdominal pain which can be treated with standard pain medication, temporary difficulty swallowing due to swelling, and nausea or vomiting. These expected events occur in more than 25% of people who have the TIF procedure. They are usually mild in severity and resolve themselves shortly after surgery. The TIF procedure may be right for you if you are at least 18 years old, have symptomatic chronic GERD, require and respond to pharmaceutical therapy, have a hiatal hernia less than or equal to 2 centimeters, and have a BMI less than 35. The TIF procedure may not be right for you if you have a bleeding disorder, chronic cough, stricture, severe esophagitis, esophageal diverticuli, an obstruction, a paraesophageal hernia, limited neck mobility, osteophytes of the spine, esophageal varices, esophageal infections or fungal disease, or esophageal stenosis. The procedure may not be right for you if you have anatomy that would prohibit insertion of the esophagus device, if you cannot adhere to the post-operative diet recommended for appropriate healing, are under 18 years old, have a hiatal hernia greater than 2 centimeters, have a BMI greater than 35, or are pregnant. Your physician may have other criteria he or she uses to determine whether you are an appropriate candidate. Ask your physician to discuss those criteria with you. To find a physician that offers TIF near you, visit gerdhelp.com. That's GERDhelp.com. and use the physician locator.